Good morning, good afternoon, good evening, everyone, and welcome to the 72nd installment of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community, and to all those who have just discovered us today, welcome po at sana po ay masayahan po kayo sa inyong mga matututunan sa araw na ito. Kamakailan po, Health Undersecretary Mirna Cabotaje announced that minors aged 12 to 17 with comorbidities may start getting COVID-19 vaccines as early as this month. We are now October 1st, so siguro mga second week, October 14th, 15th po, we will begin a pilot run in the National Capital Region. Ito pong balitang ito ay very welcome po sa karamihan, pero marami rin po ang nagkaroon ng mga katanungan katulad ng, should we really start vaccinating our children? Have we already met our targets for adults who are at high risk? Do we have enough vaccines to start vaccinating children at this age range? Kung gusto nyo pong matunghayan at makinig sa mga kasagutan ng ating mga eksperto, please stay tuned, and we hope that all of you will be able to also enjoin your families, your friends, your colleagues to join us today in our Zoom webinar. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date, and always looking forward to our Fridays po dahil po I get to share hosting duties with my partner and also our adjunct research faculty at the National Telehealth Center, really a renowned public health communications expert and the President's Special Envoy for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, Raymond. Good afternoon at magandang hapon po sa inyong lahat saan man kayo naroon. I can see a lot of our usual members of our community joining us today. And for those of you, sabi nga ni Raymond, who have just discovered us for the first time, welcome. It's really a pleasure to be here. And we are here because of you. So hindi po sa inyo, wala po kami rito. So nagpapasalamat kami na lagi po kayo nandyan. At sa abot kaya namin, we are trying our best to get you the best information, the best speakers. And definitely today, we really have another fantastic set of speakers. But before I go on, I just wanted to acknowledge na I know many of you are getting breakthrough infections, even if you've been vaccinated. And I've heard of so many frontliners na buong mga pamilya nila. In fact, even my family, even yung apo kong 7 years old, nagka-COVID. No? He's fine, they're fine, but you know, it's really a difficult time for everybody, Raymond. And while we're here, medyo masaya tayo ng konti because we're going to learn. I just want to acknowledge na if you're not feeling well or people have gotten sick in your household, we are with you. We're always thinking about you, and I think we're here because we just want to make sure that everybody gets the best information they can get so that we'll get over this. And matatapos din po ito, wag po kayong mawawalan ng pag-asa. Don't give up. We'll get through this. Matatapos po ito. Everything comes to an end. But while we're getting through this difficult period, let's be hopeful, let's be positive, and let's support one another. So welcome to everyone who's watching on the playback on YouTube and Facebook. Magandang araw po sa inyong lahat. Raymond, over to you.
Thank you, Dr. Susie. So for those po na nagkakaroon po sila ng mga watch parties, mga nanonood po sa atin sa mga Facebook accounts ng Stop COVID Deaths, University of the Philippines at ng TVUP, please send photographs sa ating FB pages po, no, para we will be able to post them and maybe share them so that we know kung nasaan man po kayo ay talagang marami po talagang nanonood ng ating mga webinars. For today, we will be talking about really a closer look at the science behind COVID-19 vaccines for children. Sa karamihan po, marami po rin pong, although marami po nag-welcome ng balitang ito, marami din po ang mga talagang naninigurado, ligtas po ba ang mga COVID-19 vaccines, pati rin po sa mga bata. Ang mga bata po ba, sa kaso po natin, marami po ba yung mas nagkakaroon ng severe COVID, baka na-hospital or na-ICU, what's the data behind this, and will the COVID-19 vaccines help for our children? But before that, we will put our discussion into context, and let's watch our person on the street video created by TVUP.
Yung dalawang anak ko may bakuna na, pero yung bunso kong 13 years old ay wala pa. Kung akong tatanungin, ayoko nang pabakunahan yung bunso ko.
Yes, I want to be vaccinated because I want to be safe from the pandemic.
Hindi po talaga. Kasi po yun nga po yung may mga cases po akong nababasa online na hindi daw po effective sa kanila. Yung iba daw po, mas napapadali pa yung buhay.
Yung dalawang anak kong dalaga, nasa 22 at 21 na sila, so nabakunahan na sila. Pero yung 11 years old ko, ayoko pa. Hindi ko pa siya ayoko pa siyang pabakunahan. Masyado pa siyang bata para mabigyan siya ng COVID vaccine.
Kasi hindi ako sigurado kung kakayanin ng katawan niya kasi nga medyo bata pa, tapos sobrang taba pa. Kaya siguro para sa akin, hindi ko papayagang bakunahan yung anak ko.
I think it's good for a lot of people, especially those who are more vulnerable to the pandemic.
Total, nandito lang naman siya sa bahay. So, hindi ko muna siya pababakunahan. Dumating man yung time na nababakunahan na yung mga 12 years old, tignan ko muna kung ano yung mga result. Pero, kasi healthy naman yung anak ko eh.
Nag-aaway po sila actually. Ayaw po ng papa ko kasi may cases po sa province nila, tumawag yung kamag-anak niya na ang dami daw pong namatay. Yung mama naman po, pinupush ako na magpabakuna kasi nga po parang required na po siya ngayon. Parang mahirap na po makapasok sa mga establishment. Ang kailangan na po talaga ng na proof ng vaccination tsaka sa mga kainan. Kaya yun din po, na-consider ko din yung mama ko. Syempre, yung part din po ng papa ko.
Siguraduhin lahat na na safe. At yun nga, yung paggamit ng mga para safe lahat. Hintayin na lang na maging normal. So, siguro doon papayag na.
Okay, thank you very much, TVUP. That was really very insightful. I think people are still hesitating, are still trying to weigh and see if this is something they want for their children. And so today, we are going to focus our discussion on the science behind vaccinations for children. Di ba? Alamin natin kung ano yung katotohanan. I know a lot of you have kids or apos. And somebody in the chat box said she's a mom and she has 3 kids and that's why she's watching. Okay. So today what we're going to do is we're going to listen to some experts. We're going to listen to some experts who will give you the best information we have right now. No, nagbabago-bagong impormasyon natin, pero kung anong alam natin ngayon, yun po ang nakukuha nyo dito sa webinar na ito. So stay with us, and I thought it was just great to see na, on the street, when you're talking to ordinary people, hindi pa sila masyadong sigurado, no? So, ano bang alam natin para kung may magtatanong sa atin, alam natin kung anong sasagutin natin. So, abangan niyo po ang maganda pong pag-uusapan natin. Raymond, over to you.
Thank you, Dr. Susie. Very raw ang yung pong ating mga nakuha sa ating person on the street interview. We hope that our experts will be able to at least allay the fears and then just mention po the science behind COVID-19 vaccines for children. Right now, we are now numbering at a little over 1,200, pero paulala ko lang po na hanggang 3,000 po ang pwedeng i-accommodate dito po sa ating Zoom webinar. So for those who are still trying to convince their friends, their families, and their colleagues to join. Sana po may makapag-join po sila para po ma-experience po nila ang full interactive na experience dito po sa ating Zoom webinar. For those who are joining us in YouTube and Facebook, we hope that you will continue to participate by commenting, providing your any questions that you may have. And speaking of questions, lalo na po sa mga hindi po makakadalo sa ating Zoom webinar, we have our Mentimeter po, no? For this week, if you go to www.menti.com, just enter the code 58946146. That's 58946146. So you'd be able to participate in our fun quiz in our Zoom poll. It's the same set of questions for the Zoom poll and for the Mentimeter. And for those who are asking, medyo under the weather po, kumbaga ang ating admin staff in terms of releasing ang mga certificates of attendance. We noticed na medyo marami po nagtatanong, pero don't worry about it. We are trying to complete the release of all of the certificates for webinar number 71. And then for this webinar, just like all previous webinars, certificates will be issued to those who have attended at least 50% of the webinar duration. Gaya rin po na nabanggit po natin kanina, for those who are joining us for the very first time, our format is we will have the speakers present their talks, then the reactions from our excellent set of reactors, and then followed by the Q&A session wherein we may be able to identify 1 to 2 members of the live audience to ask their questions po to our speakers. Over to you, Dr. Susie.
Thank you very much, Raymond. And we are really looking forward to our speakers, but let's go right to it. Raymond, we have our opening remarks. Actually, sometimes we co-sponsor these webinars with the professional societies. And for this today, because we're talking about children, this webinar is done in partnership with the Philippine Pediatrics Society. And we have opening remarks that are recorded from Dr. Efren Balanag, who is the president of the Northern Luzon chapter of the Philippine Pediatrics Society. So let's watch it.
Thank you very much for the introduction, and good afternoon to all of you. It's an honor to be opening this 72nd special edition webinar by my alma mater, University of the Philippines, Manila, headed by my Pediatrics Consultant Chancellor, Dr. Carmencita D. Padilla, in collaboration with the National Telehealth Center. I'm speaking on behalf of the Philippine Pediatric Society, Northern Luzon Chapter. This time, the topic is entitled COVID-19 Vaccines in Children, Ating Alamin. It's high time to focus our attention to our children who, at first, were not really involved epidemiology-wise because most morbidities and mortalities are coming from the adult population, and pediatric cases come few and far in between. But now, it looks like more and more children are being involved in this pandemic. I'm sure our esteemed speakers are here to highlight the urgency of the vaccines, the pros and cons of COVID-19 vaccination in children, and I hate to preempt their talks, but just to give you a clearer picture on the local front, here in Baguio General Hospital and Medical Center, a COVID referral center here in the Cordillera Administrative Region, we are not only receiving more cases compared to the same time last year, we are also now getting an unprecedentedly more severe pediatric COVID cases. This underscores the need and the right of the children to be protected from this virus. Now the question is the timing. Is this the right time in the midst of vaccine supply and procurement issues, vaccine hesitancy, and reported side effects in adults, hindering the applicability of the vaccines to children, considering the positive studies for ages 15 and below? These are but few of the hot topics that will be answered by the luminaries of pediatrics in the field of infectious diseases. Dr. Maria Liza Antoinette Gonzales, my consultant way back during residency, and now is considered a pillar in the field of pediatric infectious diseases, together with Dr. Maria Consorcia Quizon, Executive Director of the South Asia Field Epidemiology and Technology Network, will be at the helm today to answer all the questions you have in mind. Today's session becomes more exciting because of the presence of our reactors, Dr. Benny Atienza, our very own president of the Philippine Medical Association, himself being a pediatrician and an active member of PPS Incorporated. And my dear friend and batchmate from UP Medical School Class 1997, Dr. Jeng Liquido, a pediatrician all the way from Delaware, USA. So now you're up to a gripping and exciting, fresh off the grill webinar. So sit back, relax, and be informed. Thank you to all.
Okay, thank you very much. That was Dr. Efren Balanag of the Philippine Pediatric Society. And I think, Raymond, we're going to do our fun quiz now. Okay,
Yes,
go,
we should
take
do
it
that.
away.
Yes,
Again.
thank you, Dr. Susie, and thank you also to PPS Northern Luzon Chapter President, Dr. Efren Balanag. Sir, we hope that if you could follow right after you take care of your personal matters po, I will be appreciative po of it. So you'd be able to join our panel discussion later on. For our webinar, we have two questions. Dito, yung isa pong katanungan natin ay in Filipino. The second question is in English, but nevertheless,
Raymond, cute naman yan. Yung
yes,
una-
opo.
cute naman. Okay, sige.
It's a little bit unorthodox just because ganun lang po. But we try to give a little bit of new flavor kumbaga sa ating ano po,
Oh, hindi,
fun quiz.
for those who don't understand Filipino, maybe let's translate the first question, and then for those who want the second question in Tagalog, translate ka nga, Raymond. Magaling ka
Okay.
naman. Sige.
For the first question, kailangan na bang prioritize ang pediatric age group sa ngayon? So the question, at least for our foreign attendees, do we need to prioritize right now the pediatric age group? We have two options, yes or no. Overwhelming majority, at least of the 700 plus respondents are choosing yes, and we will move on to our second question. Our second question reads, can children age 12 to 17 years old with comorbidities such as cancer, diabetes, end-stage renal disease, and cardiac problems be vaccinated now? A little bit higher than the first question in terms of the yes to the majority. So we will keep our opinion poll open for our 1,300 plus attendees. But first, I'd like to greet those who are attending all the way from Dr. Paulino J. Garcia Memorial Research and Medical Center in Cabanatuan, Nueva Ecija, the Medical City Clark in Mabalacat, Pampanga, Plaridel Integrated National High School in Nagcarlan, Laguna, the DOH Eastern Visayas Regional Office in Palo Leyte, Mindanao State University in Marawi, internationally, our attendees from Taipei, Taiwan, Penang, Malaysia, Ho Chi Minh, Vietnam, Nizwa, Oman, Dubai, and UAE, Dammam, Saudi Arabia, Lunichi Ali University of Blida 2, Algeria, Ride, Sydney, Australia, and University of Fiji, Lautoka City in Fiji. Medyo namimiss na natin ang ating regular from Ontario, Canada. Nevertheless, our base keeps on growing, and we hope we get to see more and more of our attendees, not just in the Philippines but all over the world, continue to attend our Stop COVID Deaths webinar series. Okay, over to you, Dr. Susie.
Okay, thank you very much, Raymond. And I can't believe we're on webinar number 72. Is that correct? 72?
That's true. 7-2 webinars so far.
Okay, so thank you, everyone. Let's go straight to our topic, and we have a very good speaker for you. She is not new to you. In fact, we always tap her for our discussions on pediatrics because she is most knowledgeable, very easy to understand, and we like her. And in fact, we We are so grateful that she said yes to the webinar today kasi napaka-busy din, maraming ginagawa. She is actually a specialist in infectious and tropical disease for children. And she's part of the Philippine General Hospital's Department of Pediatrics, Associate Dean for Faculty and Students at the UP College of Medicine, and you know her. So we'd like to welcome Dr. Maria Liza Antoinette Gonzales, or Chet Gonzales. Chet, welcome to the webinar, and thank you so much na pinaunlakan mo ulit ang Stop COVID Deaths webinar community.
Okay, good afternoon, Doc Susie and Doc Raymond. Siyempre, mahirap naman akong humindi, di ba? So, good afternoon to you and to the UP community. Good day to all of your viewers, wherever they may be. And to my co-presenters and reactors, good afternoon din po sa inyo. So, should I start sharing my
go ahead, Chet.
Go ahead.
Yeah. Okay, can I just confirm that you can see my slides?
Yep.
Yeah, that's correct. Go ahead, Ma'am Chet.
And you're on presentation mode. Go ahead, Chet.
Okay, so the topic assigned to me is COVID-19 vaccines in children, and I would like to thank everyone here for inviting me to give this talk. Okay, sorry. Okay, so for my disclosure, in relation to this topic, which is on COVID-19 vaccines, I'm a member of the VEP and NAEFIC, and so I will be mentioning the names of these vaccines, but I am not personally endorsing any of these vaccines. So for this afternoon, we will be discussing considerations for the use of the COVID-19 vaccines in children, what is the evidence for the safety and efficacy of these vaccines, and what are the current recommendations for the use of these vaccines in children and adolescents. Okay, so let's start. So we do know that children comprise just a small proportion of the diagnosed COVID-19 cases. They say 2 to 3% to less than 10%. However, because we do not do systematic testing of cases, of pediatric cases for COVID, and because most of these children may present with mild disease or are actually asymptomatic, we don't actually know the true burden of pediatric COVID infections. So as we already mentioned, COVID-19 disease in children is generally mild with an overall good prognosis compared to adults. However, the presence of underlying medical conditions or certain co-infections may actually increase the risk for severe or critical disease in children. So the classification of disease in children, COVID-19 disease in children, is based on severity. And 80% would present with mild to moderate COVID, 2 to 12% would be severe, and about 2 to 10% critical. So 80% moderate to mild, and only about 20% would be severe or critical. So what are these risk factors that increase the severity of COVID-19 in children? So the presence of cardiovascular disease, neurologic conditions, neurodevelopmental disorders, chronic lung disease, immunosuppression, cancer or malignancies, genetic endocrine diseases, as well as obesity and prematurity would increase the risk for severe COVID in children. And we also have what we know as this hyperinflammatory syndrome in children, the multi-system inflammatory syndrome in children, which resembles Kawasaki disease and is actually considered as severe COVID. Okay, so so this disease might occur during, so with the COVID infection, or may present after COVID infection. Okay, so what are the considerations for use of the COVID-19 vaccines in children and adolescents, knowing that background? Okay, so we have certain considerations, starting with the epidemiology or burden, the safety and efficacy or effectiveness of the vaccine, so mathematical modeling relating to population level impact of vaccinating this age group, what are the programmatic implications, potential vaccination delivery challenges, okay, and acceptance of the vaccination in this age group. So we heard what the person on the street or what the parents were actually saying about accepting this COVID-19 vaccines for their own children. So let's start with the epidemiology or disease burden of COVID-19. So in countries where the proportion of young in the population is high, over 1/3 of COVID-19 cases occur in children. And most of the cases are mild, as we already said, but still a significant number, about 20%, will present with severe or even critical disease that will require ICU admission or even result in mortality. And there are some children who experience long COVID symptoms. Increased transmissibility of the Delta variant across all age groups results in, maybe that's the reason why we are seeing an increasing number of cases in children. And the emergence of new variants may also pose a greater risk if the children and adolescents remain susceptible or non-immune. And with the older age groups being increasingly protected by vaccination, a greater proportion of COVID-19 is now anticipated to occur in the younger age groups, so the adolescents and children. And the growing number of these unvaccinated children, with increase in the numbers added to the birth cohort with the deliveries, no, this will result in ongoing transmission. Okay, so this is the latest data that I was able to get as of September 29. I'm sure meron ng September 30, no? But there were 2.5 million cases of COVID-19, and of these positive cases, about 10% would be less than 20 years old, and of that, around 6% would be less than 15. So we see that there are children who are being infected. And if we take a look at the population pyramid of the Philippines, which is very similar to what we would expect in developing countries, no, we have a young population. So more of our people or population would be in the younger age groups. So for example, in this 2020 population pyramid, about 30% would be less than 14, and about 20% would be 15 to 24 years old. So this is in contrast, for example, to industrialized countries where you expect more of the population to be older and even elderly population. So we are a young population. And this is important to consider when we talk about herd immunity. So herd immunity can only be achieved if we have a significant proportion of the population who are immune, either through vaccination or from getting the infection. And of course, we want to make sure that we achieve herd immunity by increasing vaccination coverage, not by increasing the exposure of our people, because that would result in unnecessary cases and even deaths. So what we want to do is to increase the vaccination coverage in order to reach herd immunity. Now, the threshold to be able to reach that herd immunity is based on a number of factors, including the contagiousness of the virus, which is given here as the basic reproduction number, or the R0, as well as the efficacy or effectiveness of the vaccine. So for COVID, for example, for SARS-CoV-2, the herd immunity threshold is placed at 60 to 80%. Now, as I mentioned, it will depend, of course, on the efficacy of the vaccine. For example, on the graph on the left, if you have a vaccine efficacy of about 90 to 95% with an R0 or contagiousness of 2.5, which means that for every infected individual, he or she will now spread it to 2.5 more people, Okay. With that, you will need a vaccination coverage of around 70 to 80%. But with lower vaccine efficacy, for example, if the vaccine efficacy is only 62%, then take note, you will need to vaccinate almost all of the population. And this includes children. So when you say that you will vaccinate 80 to 90% of the population, that does not mean 80 to 90% of those who are 60 years old and above, or 80 to 90% of the frontliners. No, it means 80 to 90% of the entire population. And that will, of course, include children. So this just shows you how important herd immunity is. And if I may borrow a saying, it mentions that no one is safe unless everyone is safe. And that, of course, includes your children and adolescents. So let's move on to the next consideration for introducing vaccines in children. And this should be based on vaccine safety, efficacy, and effectiveness that we derive from clinical trials, as well as effectiveness data from real-world vaccination program experiences. Okay, and what we know is that there is actually high-level evidence with regards to safety, strong immunogenicity, and efficacy of the COVID-19 vaccines for adolescents for the 2 mRNA vaccines. So in this first study, this is a phase 3 trial to determine the safety, immunogenicity, and efficacy of the Pfizer, which is now called the Comirnaty vaccine, in adolescents 12 to 15 compared to young adults 16 to 25 years. So in this trial, they enrolled or included more than 2,200 adolescents aged 12 to 15 to receive 2 doses of the Pfizer vaccine given 21 days apart. And the data would show that it has a favorable safety and side effect profile. If you take a look at the right side on the bar graphs here, we show that most of the side effects are mild, as seen here by the green bars, or moderate, as seen here by the blue bars. So for the local side effects, the most common would be injection site pain. And for the systemic side effects, the most common would be fatigue, headache, and chills. So these are not uncommon reactions seen with other vaccines. So they are not unusual, okay? And severe reactions occurred, but in fact, they were even lower in the younger age group compared to the young adults. And fortunately, in this trial, there were no vaccine-related serious adverse events and only a few overall severe adverse events seen. Now, what about the antibody titers? So if we take a look at the geometric mean neutralizing antibody titers, for the 12 to 15-year age group, it was 1,239. And this is 1.8 times higher than the 16 to 25 years age group. So it means that it is immunogenic. The vaccine is immunogenic in the 12 to 15-year-old age group, and in fact, it even gives rise to higher neutralizing antibodies compared to the young adults 16 to 25 years. For vaccine efficacy, in preventing COVID-19, symptomatic COVID-19 after 2 doses in participants without evidence of previous infection, and even in those who were previously infected, the efficacy is 100%. So with a range of around 75 to 100%. So it's a very good efficacy. Now, this second study is a phase 2/3 clinical trial evaluating the Moderna vaccine in adolescents 12 to 17 years compared to the young adults 18 to 25 years. So Moderna, or the Moderna vaccine, yes, is also given as 2 doses, 28 days apart. And what was shown is that the side effects or the adverse events that were seen were also not unusual. So the most common solicited adverse reactions after both the first and second injections were injection site pain, headache, and fatigue. So similar to the Pfizer vaccine. Most of the reactions were seen after the second dose, and most were mild or grade 1, again represented by the green bars, or moderate, represented by the blue bars. Okay. Okay. So there were no serious adverse events related to the study vaccines. There were a few severe reactions, local and systemic reactions, represented by the orange bars, but they were very few. Now, with regards to immunogenicity, the geometric mean titers in the 12 to 17-year age group compared to the 18 to 25-year age group is not really significantly different, but not inferior. So it is not inferior, and it is similar. The titers in the younger age group, 12 to 17, is not inferior to the titers, the antibody titers seen in the 18 to 25-year age group. And for vaccine efficacy against COVID-19, there were no cases of COVID-19 seen in those who were given the Moderna vaccine, but there were 4 cases of COVID-19 seen in the placebo group, which gives vaccine efficacy of 100%. Now, using a different definition, a more a more, not stricter, what's the opposite, easier definition, just any respiratory symptom with a positive test, then the vaccine efficacy is still high. It's still 93%. So again, very good. Okay. Now let's talk about vaccine effectiveness. There are really no published effectiveness studies of the COVID-19 vaccine in adolescents or adolescents or children. And vaccine effectiveness can, however, be inferred from the immunogenicity data that we have. So this is called immunobridging analysis. So the effectiveness is inferred from the neutralizing antibodies, okay, that is considered to be clinically relevant to infer effectiveness in the pediatric age group. And of course, we do not have yet a specific antibody titer to establish or predict protection. But what we want to show is that it is not inferior or better if it is similar or even greater compared to the young adults. And that is what we have demonstrated in the 2 of the important studies regarding the mRNA vaccines. So we consider both the geometric mean titers and the seroresponse, and we compare the response that we see in adolescents versus the young adult populations. And again, as we mentioned, similar or not inferior. Okay, now there is actually one vaccine effectiveness study in children and adolescents, but this is not published yet. This is just presented in this editorial. And what I am presenting now is the interim analysis. So this study was conducted in Israel. As we know, Israel is one of the countries with the rapid and effective, successful vaccine rollout. So they started during the last quarter of last year. And then in January of this year, they already included the 16 to 18 year old in the priority vaccination group. So they were able to vaccinate more than 200,000 as of at the time that they did the analysis. And it showed a vaccine effectiveness against symptomatic COVID-19 of 98% and a similar effectiveness against hospitalization in the 16 to 18-year-old age group. And there were no cases of severe or critical COVID-19 and in those who were vaccinated, whereas in the unvaccinated group, 15 were hospitalized, 2 in critical condition, and 1 died. So they had very good experience in Israel. So to maybe summarize what we have seen, the data we have seen in the 2 studies, as well as the vaccine effectiveness study in Israel, the mRNA vaccine, so both the Pfizer and Moderna vaccines, produced a greater or similar immune response compared to young adults. Both had a favorable safety profile, and both were highly effective against COVID-19. Okay, so let's talk a little bit more about adverse events and side effects, because as we heard from many people, this is actually a concern. So as we saw from the clinical trials and even from the real world experience in Israel, there were no unusual side effects. Most of the side effects were local or systemic adverse effects, and these were mild to moderate. Allergic reactions, mild allergic reactions were seen, but anaphylaxis was rare. And rarer still is the immune-mediated adverse event of immune thrombocytopenia, seen in less than 1 in a million. But what was truly concerning were the reports of myocarditis or pericarditis or myopericarditis in 12.6 per 1 million vaccinated vaccinees. Okay? So this was a bit concerning because it is greater or higher than the expected rates. So in the United States, they have 2 vaccine safety surveillance systems. The first is the Vaccine Adverse Events Report System, or the VAERS, and the other is the VSafe, what's the name again? The VSafe Health Check-in Survey, which is a smartphone-based safety surveillance reporting system. So here, the adolescents who were vaccinated can register and actually directly report whatever side effects they are experiencing. And we see here that, again, no unusual adverse effects, local and systemic reactions, okay, were reported, okay, especially after those 2, but nothing unusual. This is what we usually see with the other vaccines. Now, there were also a few who actually needed medical care or were hospitalized, very few, but because it is a passive type of reporting, we don't really know what was the cause for the vaccination. So in terms of the VSafe Health Check-in survey involving 129,000 adolescents aged 12 to 17, no safety alarms. However, for the vaccine adverse event reporting system, or the VAERS, from December to July 16, so although 90% would be non-serious, okay, 10% reported serious adverse events. And here you will notice that myocarditis was actually reported in 40% of the serious, or 397 out of a total of 9,246 reports. So that's about 4.3% reported myocarditis. And you will also note that many of the side effects reported were actually related to myocarditis, such as chest pain, increased troponin, normal echocardiogram. So these are all may be related to the myocarditis. Okay. Okay. So this is so how was the myocarditis diagnosed in patients who received the vaccine? So by echocardiography, what they usually would see would be reduced or diminished ventricular function or abnormal ejection fraction. And some of the cases would present with mild pleural effusion. These pictures actually show results from the cardiac MRI, cardiac resonance imaging, no, after receiving the vaccine. And what is demonstrated here is enhancement of the subepicardial and mid-myocardial sections, particularly the inferior and inferolateral ventricle walls. Okay, so this is what you would demonstrate when you do a cardiac MR for patients with myopericarditis. So what do we know about myocarditis or pericarditis after the mRNA vaccines? So we do know that myocardial injury has been reported in 36% of hospitalized COVID-19 patients. So it's actually part of COVID-19 infection, and it can occur even after the patients have recovered from COVID-19. And 36% is higher than what we see in patients, in normal people who are who receive the vaccine. Okay, so myocarditis or myocardial injury occurs in a higher percentage of those who are infected compared to those who are vaccinated. Okay, so the overall incidence of myocarditis per 1 million doses administered is 12.6 for both mRNA vaccines combined. The incidence is greater in male, adolescents, and young adults, 12 to 29 years, so less than 30 years old, usually seen in the first 7 days or within 3 weeks after the second dose. So the risk is greater in males and after the second dose. How do they present? They present with chest pain, shortness of breath, or palpitations. And how they are diagnosed either by elevated troponin levels or abnormal findings on the ECG, echocardiogram, or cardiac MRI, such as what I showed you earlier. But the good thing is, in those cases of myocarditis that developed after vaccination, 95% of the cases were mild and recovered on their own. It was transient, lasting only for about 2 to 3 days. And were just given minimal treatment with, for example, NSAIDs, okay, and rest. Okay, so they very mild and transient. Now the CDC, before they recommended to include vaccinating children, conducted this risk-benefit analysis to compare the benefit of giving the vaccine in terms of preventing COVID-19 cases, COVID-19 hospitalization, ICU admissions, and even deaths, and compare this with the risk of myocarditis. And what we see here is that across the ages, the benefits actually outweigh the risk. However, the benefit and the risk is not balanced across the ages. Why? Because we see poorer outcomes of the COVID-19 disease in those who were greater than 30 years old and a greater risk of myocarditis in those who are younger. So if, for example, we take the age group 12 to 17, because that is our focus for this morning, and per 2 million mRNA vaccine doses administered, among the males, we see that there will be 5,700 cases prevented, 215 hospitalizations prevented, 71 ICU admissions, and 2 deaths prevented. However, there will be 56 to 69 cases of myocarditis that can be reported. Okay, so with this particular data, the CDC ACIP advisory group with regards to vaccination concluded that for COVID-19 vaccines, the benefits will still outweigh the risk even for the younger age group, including adolescents. Okay, and the risk meaning including myocarditis. Okay, and it is important to monitor the outcome of the myocarditis in those who develop this after vaccination. So there is continued monitoring of these cases because we do not know what the long-term effect will be. And thirdly, they would like this information to be disseminated so that people will be aware of what to watch out for after vaccinating. But I guess the bottom line is the myocarditis and pericarditis are much more common if you get the disease, okay, rather than from the vaccine, and the risk to the heart from the infection can be more severe. Okay, and there is another risk-benefit assessment, this time conducted by UK, by the Joint Commission on Vaccination and Immunization. Again, they did this because they also were studying whether to recommend the COVID-19 vaccines for adolescents. And here they showed that the benefit of the vaccine for the first dose, it will prevent 2 intensive care admissions and 87 hospital admissions, but may result in 3 to 17 cases of myocarditis. And they saw that this was more acceptable, the first dose. But for the second dose, they are a little bit wary because it would prevent 0.16 ICU admissions, 6 hospitalizations, but will result in a higher number of cases of myocarditis. I guess this is the reason why in their recommendation, they would rather focus on giving the first dose first to all the adolescents before they give the second dose. So what are the benefits of COVID-19 vaccination? It will prevent COVID-19 and its complications. It will reduce transmission in the broader population. And in this specific setting, which is children, adolescents, in the schools, it will prevent transmission. It will mitigate the psychosocial impact resulting from disruption in school, sports, other organized activities, socializing, because of the isolation of this age group that are key to adolescent physical and mental well-being. And I think that is very important also to consider. So what are the recommendations? I'm into my last few slides. AAP, as of August 2, 2021, they recommend vaccinating all children and adolescents 12 years of age and older who do not have contraindications. What vaccines do they use? Those vaccines that have been approved by the US FDA and recommended by the CDC. And lastly, because of the importance of routine vaccination and rapid uptake of COVID-19 vaccines, then they support co-administration with the other routine and adolescent immunizations. So CDC recommends the vaccination for everyone aged 12 years and older to prevent the corona disease 2019. So adolescents aged 12 to 17 are eligible to receive the Pfizer vaccine, and they may be vaccinated with appropriate consent and assent. Children younger than 12 years are not eligible to receive Pfizer vaccine at this time, and children and adolescents younger than 18 are not eligible to receive the Moderna or Janssen COVID-19 vaccine at this time. So only Pfizer is recommended or approved for children less than 18, 12 to 17 years old. So what are the countries with an EUA for this vaccine, for the Pfizer vaccine? You have quite a number, and some of them have actually already started vaccinating the adolescents. No? Initially, some of them would start with those with underlying medical conditions, but would later on move to universal or routine vaccination of all children 12 to 17 years old. Okay. And we see here that in the Philippines, we already actually have an EUA for Pfizer as of May 28, 2021, and for Moderna, an FDA EUA in September 2, 2021. So for both, for active immunization for the prevention of COVID-19 in individuals 12 years of age and older. So they had an amendment of their EUA because previously only for 18 and above. Okay, so what does the National COVID-19 Vaccination Operation Center have to say about this? Okay, so I think there is no argument that these vaccines, the mRNA vaccines, are effective and safe for children. The Department of Health All Experts Group reiterates their initial recommendation that vaccination of children and adolescents, even those with comorbidities, shall only begin once the supply of vaccines is adequate and stable. So I think there is no issue about the efficacy, safety. It's more on supply. And this is reiterated by the PPS and PIDSP, who recommend that the priority should still be the older and more vulnerable adult age group. And once we have a sufficient percentage of these priority adult groups that have been vaccinated, then we can start vaccinating children 12 years old and above. Okay? And priority is given to those in areas with high transmission and those with comorbidities. And the fear then was that if you give pediatric vaccination at a time when we still did not have sufficient numbers of our priority adult groups vaccinated or insufficient vaccine supply, then this may disenfranchise the limited supply of vaccines to the more vulnerable groups, such as the senior citizens and adults with comorbidities. So in view of that, as of August 11, we were not yet vaccinating children 17 years old and below. However, 3 days ago, President Duterte already announced that immunocompromised children 12 to 17 will be vaccinated, and this vaccination will start in October. So the Department of Health announced that adolescents with comorbidities will be added to the A3 priority sector, and they will be given Pfizer and Moderna or Moderna COVID-19 vaccine. So the government is aiming to start October 15 because the capital region in Manila, because Manila already has an impressive vaccination coverage, and I think we have been assured that by October we will have enough supplies, and then after Manila, then they could expand to other regions after the first 2 weeks of the pilot implementation. Now there are other vaccines, COVID-19 vaccines that are being studied. So Novavax, Janssen, AstraZeneca, and the Pfizer and Moderna have ongoing studies in infants as young as 6 months. Sinovac also has actually a study on children 3 to 17 years old. They have actually published a paper, which is a phase 1-2 clinical trial, and which concluded, because this is the first report of an inactivated vaccine, the CoronaVac, being tested in children and adolescents 3 to 17 years old, and because it is just a phase 1-2 clinical trial, which is mostly safety and immunogenicity, they found that it was relatively safe and immunogenic in this age group. So we look forward to their later phase 3 trials that can be published soon. So the ongoing challenges in the COVID-19 vaccination of children and adolescents is again because of the constraints on vaccine supply. So that is a key determinant. Okay, and when we start vaccinating children and adolescents, we have to augment the existing infrastructure for vaccination. Okay, so we need to make sure that there are care providers that are experienced in dealing with children and adolescents who are being vaccinated. And of course, logistical concerns, because we know that the Pfizer vaccine needs ultra-low freezer storage requirements, so that might be an issue. Okay? And data on vaccine safety is ongoing. We are still following up these children who develop adverse events, and we are continuously monitoring the long-term effects of the vaccine in children and adolescents. So in summary, children and adolescents represent a growing proportion of new COVID-19 cases. Children and adolescents can experience serious outcomes from infection and can transmit the virus. COVID-19 mRNA vaccines have been shown to be safe, effective, immunogenic in preventing COVID-19, and vaccinating children against COVID-19 will be essential to protect their health and to establish higher population immunity. So that's the end of my slide. Thank you very much for listening.
Okay, thank you very much. That's Dr. Chet Gonzales. Napakahusay, no? A wonderful presentation, Chet. Thank you so much. Very clear. And as you can see, Chet will show you the pros and the cons. Wala pong tinatago, no? It's a very authentic presentation, which is showing us that really we have to make decisions based on, does the benefit outweigh the risk? So napakahusay po ng presentation niya, and I hope you all learned as much as we are learning. And we're now moving to our next speaker. Okay, so again, another excellent presenter. And in the Stop COVID Death webinars, we love field epidemiologists. You've met some of them, Eric Tayag, Rio Magpantay, and this is another one of those very outstanding field epidemiologists. They're called field epidemiologists because in their discipline, mababa talaga sila sa ground. Hindi lang nakaupo sa, nakaupo sa ospital or sa opisina, pero they really investigate things on the ground. And through these many years that I've known our next speaker, I would say that I am a fan, an admirer. She's really very, what should I say, analytic, straightforward, no nonsense, and she's very well known in the Department of Health where she served for many years. So she is currently a member of the Interim National Immunization Technical Advisory Group. Okay, so nag-a-advise siya. Tapos she serves as the Executive Director of the South Asia, so this is now regional, South Asia Field Epidemiology and Technical Network, or SAFETYNET. So I am very honored to welcome Dr. Maria Consorcia Quizon, or Conky, as we know her. Conky, welcome to the webinar.
Thank you. Thank you, Susie. And thank you to the very first speaker, Dr. Gonzales, because she actually said most of what I was supposed to say. But at least ba ma-reinforce, and then I feel that, okay, she said that, and I will just give a bigger picture of the epidemiology, okay? So if I can start sharing my screen.
Yes, go ahead, ma'am.
Okay, so good afternoon, everybody. No, I put some objectives here. I said I would like to describe the Philippine COVID epidemic as to person, place, and time, and tell you a little bit about vaccine distribution in an effort to make you understand. I mean, Dr. Gonzales gave the pros and cons of immunization for children. Now, given the numbers that I'm going to share with you, we hope that could make the picture clearer in your minds, what the situation is really is, okay? So I borrowed the slides from the Epidemiology Bureau. I dare not mess with any of the data that they're giving us. And it's September 26, just a few days shy from yung kung ano yung present ni Dr. Gonzales, okay? So globally, how do okay, so that's always the start, no? How many do we have globally? So we have about, actually I don't see my slide. Sorry. O sige. So ayun yung global number, and I do not know why the DOH compared, ito yung top 3 cases, 42 million sa US, 33 million sa India, 21 million plus in Brazil. And I don't know why there is some reference to China, which has very, very few. Okay, so bottom line is, it says here that the Philippines standing on confirmed cases, the number of cases that we have accounts for a little over 1% of the global cases that we have. Okay, so ayun po, nakalagay na parang about 2.5 million ang number of cases natin. Equally divided, 50-50, male and female. The most affected group are the 20 to 29-year-olds, okay? And most of the cases come from NCR, okay? So just a little bit more, actually this is translated into 32% coming from NCR and 18% coming from Region 4 Calabarzon, and 10% of all cases coming from Central Luzon. So kung sasabihin yung the whole Luzon, it actually accounts for 60% just looking at NCR, Region 4 Calabarzon, and Region 3. Okay, just a little bit more, no? So our case fatality rate is 1.5%, which is okay. I consider this as good news because globally it's 2.1% yung case fatality rate, and sa atin is 1.5%. Okay, so let me just go back in comparison ko with the number of cases in the first 3, the highest reporting regions. 60% again from the total cases come from NCR, Calabarzon, and Region 3. However, where it comes to deaths, they account for 50%. So ibig sabihin, the rest of the country has a slightly higher CFR or case fatality rate than NCR, Calabarzon, and Region 3. Okay, so this is our distribution of cases by sex and age. Okay, so as you can see, the 20 to 29-year age group up to 40 accounts for most. Idagdag mo na yung hanggang below 60 to 20 to below 60, and I guess because these are the people who are going out, who are working, kaya sila ang nahahawa, and that's why they account for the most number of cases. Okay, so please take note of the 10 to 19 age group as well as the below 10, which accounts respectively for 5% and 10% of the group. So hindi ganoon karami as far as this graph is showing us. Okay, when we go to the deaths by sex and age group, bumalik nagtagtad or nag-reverse actually. No? Let me go up again. The number of cases is smaller as we go up the age group. But however, when it comes to deaths, mas marami. The older you get, mas marami namamatay. Okay. Again, when we look at the less than 10 or even the 10 to 19, there is really markedly fewer deaths and cases when it gets to these age groups. Okay, so these are the numbers as given to us. So just very, very quickly, you look at the age group below 10, 109,000 out of the total of around 2.5 million cases. 10 to 19, 187,000 out of the 2.5. So respectively, this is about 10%, 10 to 12% of the total number of cases, yung mga below 20. And then for the deaths, it's even very, very small, 357 and 247 out of 37,405 deaths recorded in the country. Okay, so well, these are just the distribution of cases, and the top three, as I mentioned a while back, is the National Capital Region, followed by Calabarzon, and the third is Central Luzon. Conversely, yung lowest is Bangsamoro, Region 4B, Mimaropa, and Region 9, or the Zamboanga Peninsula. Okay, so person, I talked to you about the person and then the place, and then we looked at the time, you know. I don't know how many of you are able to follow this through, because yeah, even if we read the newspaper or we hear something every day, it's like snapshots. There are 12,000 cases, 5,000 cases, but it will be good if we are able to get like this opportunity to actually see the epic curve. Okay, this is a rather busy slide, and I would just like you to focus on the black line that shows you the curve, or how the epidemic is moving from January 16, 2020 to September 2021. Okay, so we were on lockdown until May 31, and then we experienced the first surge. At that time, they were calling it the wave, you know, so now meron na tayong ibang pangalan, surge na ngayon. And then we experienced the next big surge before Holy Week. And then eto na tayo, nandito tayo sa latest surge natin, which is actually going down. Now, what I want to show you and what I want you to worry about, because I worry about this, is that if you look at this on the first surge, you know, and then, okay, good, it went down, the number of cases went down, but it is too much to ask for it to go down to zero or no cases at all, right? So at that time, from November up to before our surge, sometime in March, you know, the reported number of cases was something like 1,000 to 2,000 new cases per day. Then we had the surge before Holy Week, you know, and we breached the number of new cases to more than 10,000 per day. If I remember right, nakarating pa ng almost 15,000, you know, and then it went down. However, when we said that the number of cases went down, we were still talking about 5,000 to 6,000 cases per day. So it's small wonder when the next wave came along, talagang the spike would really be higher. And then now that we're getting down, we've reached the 20,000 per day, okay? And then now we're down to what? 10, 12,000 a day. And then, is it fiesta time? Are we happy? Are we saying, okay, we're done. Okay, tapos na tayo doon sa search, peacetime uli. Are we happy again? Or comforted with the idea that it went down, but we will still be seeing, what, 10,000 cases a day? So magsisid na naman yan. Kung komportable tayo sa okay na lang yun na 10,000 per day until the next surge comes along in probably 16 to 20 weeks. And therefore, what do we expect? Again, it will be infinitely, infinitely higher than the spike that we are seeing now, because we weren't really able to pull down the number of cases that we see every day, even though we say bumaba na ang mga number of cases. I worry about that, but honestly, I don't know how to say how low is low. How can we say that we have actually controlled, at least for the moment, the number of cases? Okay, so having said that, just to tell you, yung tungkol do sa vaccine distribution, no? Or actually it should be vaccine coverage. Look at this for the A1, 96%. This is the one particular group which we hope would really be 100%, you know. For the senior citizens, it's a little more than half, or 50%. For the individuals with comorbidities, it's 66.15%. It may look good, well, at least not as bad, na ganun ang mga porsyento natin. But please remember that there is a range. You know, some regions would have as low as 10%, and some LGUs are able to boast na we've covered 100%. Okay, so this is just the range. So I'm showing just this slide, you know, just to tell you na these were our administered doses. No, these are not the number of vaccines that actually enter the country. So far, or with the latest data that I have, 22 million first doses, 17 million second doses. Now, the importance of this slide for me is to show you that 13 million doses were Sinovac. So more than half Sinovac, and then followed by AstraZeneca. Pfizer actually accounts for less than 5%, and so does Moderna. And the reason why I'm saying this is because nakita natin na ang pwedeng bakuna para sa lower age group is the Pfizer and Moderna, but these are not the vaccines that we are getting or comes to us ngayon sa Pilipinas. So Dr. Gonzales already showed kung ano yung talagang recommendations at sinasabi ng all experts group and ng DOH, and we stand by that. So it's unfortunate that for example, the president will say, okay, we're going to vaccinate when hindi pa available, and maybe the science of it all is not yet 100%. You know, it's very rare, as the case should be, that policies or things that we have to do on the public health side can and should be influenced by a few studies. You know, I know that the argument is also that, well, we can't just wait. You know, people are dying or people are getting infected, but we still have to wait for the science of it all. So when the higher ups declare that, okay, let's give it, number one, maybe they know and we don't know because it's beyond our pay grade that Pfizer and Moderna vaccine are going to come talaga in the next few weeks. We don't know that. Kasi itong dalawa lang na to ang sinasabing pwede natin gamitin for children at the moment. So, maibibigay nyo ba sa amin? Available ba? Pangalawa, yun nga, nakakaalangan pa rin because we don't know if, okay, are we really safe or can we do this already given the relative paucity of data? Can we really start vaccinating children? Because the last thing that we want to have is the Vaxia Season 2 episodes. Okay? So I'll stop on this and just maybe mamaya tayo magkwentuhan o magbalitaktakan with your questions and answers sa discussion. Thank you very much.
Thank you very much, Conky, for that presentation. Some people are asking for your slides. So I think Raymond will find a way to do that. Okay, so thanks so much. I think that Zoom out was really very good for everybody. Okay, so Raymond, over to you.
Thank you, Dr. Susie, and thank you to our two excellent speakers who have provided really a comprehensive take on COVID-19 vaccines for our children. Our next two speakers will be reacting to the presentations provided by our main discussants. The first of which is PMA President Dr. Benito Atienza, who himself is also a pediatrician. We are very, very honored to have him in our webinar, and we hope that a whole lot of our PMA members are also tuned in to this webinar. Dr. Benny?
Yes.
Yes, sir. Go ahead, sir.
Again, thank you very much. It is a great pleasure and privilege for me to be invited in this webinar 72. And Dr. Liza Gonzales discussed extensively the COVID-19 vaccine in children, while Dr. Consorcia Quizon gave the clearer picture of the COVID-19 in epidemiologic perspective. First slide po. Yan. Vaccines for children, COVID-19 vaccines for children, Ating Alamin. Next slide. Palagi ko pong sinasabi, I am proudly vaccinated. Kinote po to ng DOH. Matakot po tayo sa COVID-19. Huwag maniwala sa fake news at magpabakuna. With the reality of the increasing cases of the COVID-19 in our country, especially with the new variants, especially the Delta variants, coupled with the gradual rollout of our COVID-19 vaccine, we do believe nowadays that access to reliable and scientific-based information katulad po nito, dapat po ang mamamayang Pilipino ay naniniwala po sa mga expert, yung po gumagawa ng bakuna, nagbabakuna, at hindi po tayo naniniwala kung kani-kanino lang mga chismis at saka sa social media. And scientific-based information is more important than ever. Ako po isang pediatrician, nagbabakuna po ako for the last 30 years in my practice. And ano po yung nakikita ko sa ating mga bata during the second and third surge po ng COVID-19? Ang question po natin, are the children at the lower risk of COVID-19 than adults? So far, that data suggests that the children under age of 18 presents about 8.5% of the reported cases and relatively few deaths compared, kasi na-explain po na ni Dr. Gonzales yan, age group and usually mild disease. However, cases of critical illness have been reported. As of now, in my practice po, hindi na-mention po kanina, marami po tayong mga buntis na positive. And ilan na po yung na-catch ko na baby na dumaan po sa akin. Buti na lang yung iba po ay negative. Yung mga babies po natin, marami rin ay nagpa-positive. Doon po sa aming ospital, out of 10 po na nanay na mga anak, 4 po ang nagpa-positive na mother at mga 1 o 2 lang pong baby naman ang nagpa-positive. Kaya tinetesting po sila. However, cases of illness have been reported. As with others, pre-existing medical conditions had been suggested as a risk factor for severe disease and extensive care admission in children. Kaya po ngayon, lalo po ngayon, palalahanan po natin ang ating mga kababayan na ngayon po ay panahon ng tag-ulan at sumasabay po ang mga cases po ng dengue, nandyan po ang mga flu, talagang flu. Kaya po nakakalito, lalo po ilan po yung aking pasyente sumasabay po yung dengue sa COVID-19. Kaya po dumadami ang reported cases po natin sa bata kasi natetest po. Like in my isang pasyente ko po, yung lolo, OFW, pumunta po sa Pilipinas, umuwi, nakisalamuha sa mga kasama, nag-birthday. Tapos yung asawa niya na may bakuna, may ubo, may sipon, sakala po nila nalaman na positive noong magpa-test. Lahat po ng 15 na kasama sa bahay nag-positive. Ay yung pinagtatrabuhan. Nung tinrelease po namin, 50 po, galing po sa isang source, 50 po inahawa. Kaya importante po na sa na po nanggagaling ang ating COVID-19 ngayon sa ating community, sa ating mga bahay. Kaya apektado rin po yung mga bata natin. Although nabakunahan na yung iba, marami po pong hindi nababakunahan. Current evidences suggest that people with underlying conditions as chronic respiratory illness, including asthma, moderate to severe obesity, nasabi na rin po ito ni Dr. Gonzales, cancer are the higher risk of developing severe disease and death than people without other health condition. At ito po ay nangyayari rin sa mga bata, appears to be the case of children, but more information is still needed. As children generally have mild illness, katulad sinabi ko, marami po akong pasyente, saka po lang na namin na may sipon lang, simple lang, walang lagnat. Sabi ng nanay, Dok, hindi namin madadala yung pasyente namin sa inyo. Bakit? Kasi positive po kami sa COVID. Sabi ko, ay di ipatest yung lahat ng anak ninyo. True enough, lahat sila positive sa bahay. Cases may sometimes go unnoticed. Yan sinasabi ko, lalo po sa mga bata, hindi natin po alam. May pasyente po ako nakipaglaro lang sa kapitbahay. Siya ang nagdala dun sa bahay nila ng COVID. Nakita-kita sila sa emergency room. Importantly, early data from studies suggest that infection rates among teenagers may be higher than in younger children. Ipakikita ko lang po, medyo malabo lang po. Ito yung vaccination coverage that Dr. Mirna Kabutahe presented us during our meeting. And ito po ang dapat maging basis natin kung dapat bang bakunahan na natin yung mga bata sa ating mga areas. It depends po sa region. Like this one, you can note po ang NCR po ay nasa nasa 86% coverage. Then in second dose is 72. Ang hindi na lang po nababakunahan sa NCR is 1.1 million doon sa expected po na nabakunahan. But tingnan niyo po ang region 3 and Calabarzon. Pag tinotal po ninyo yung Calabarzon, ano po yan? 13 million pa ang hindi nababakunahan, which is malapit po ang area ng Calabarzon, Southern Tagalog at saka Central Luzon, Region 3. Kaya napakarami po. And bakit marami pa kayang hindi po nababakunahan? Just remember po, yung pong binigyan ng mga Dembactia vaccine way back 3 to 4 years ago, sila po yung mga adolescent na. Ay saan po nanggaling yon? Wala pong study tayo na yung bang mga magulang na nabakunahan ng Dembactia ay nagpabakuna ng COVID-19 at sila ba ay magpapabakuna rin ng COVID-19 ngayon kung even though nabakunahan sila. Yung pong hesitancy sa kanila pa rin ba nanggagaling? Kasi yung po nabigyan na 800,000 na Dembactia ay galing po sa Region 3, Central Luzon, Southern Tagalog, NCR, and Cebu. Kaya po siguro dapat anuhin po natin yon. Baka nakadagdag po yun sa hesitancy. Baka yung hindi po nagpapabakuna ay mga magulang o kamag-anak po noon nabigyan ng Dembactia, wala po tayong study na ginawa doon. Then, ang sinasabi po natin, kung ganito po ang mangyayari na magbibigay po tayo ng bakuna sa mga bata, ang makakapag-ano lang po NCR, ang makakasunod lang po kasi marami na po nabakunahan ng matatanda. And how much vaccines po ang kailangan natin for the 12 to 17? Sabi po nila 12 million doses. Kaya po, di ba, ayun po, pwede na ibakuna doon sa Region 3 and 4 na ngayon po ay nag-iintay pa rin ng mga bakuna. Next slide. Yan. Ito po yung binigay na statement ng PITSPIP po at saka po ng ating Philippine Pediatric Society. With all this consideration, the Philippine Pediatric Society and Pediatric Infectious Disease of the Philippines recommended that older and more vulnerable age groups should be prioritized in the vaccination rollout with the equitable distribution among different regions in the country. At nakita po ninyo, pag lumalayo na po sa Manila, mas maano po, meron po tayo mga 15% yung bump po. Once the whole country has a sufficient percentage vaccinated in the priority adult groups, children 12 years old and above may be considered for vaccination. Vaccination rollout can be initiated in high transmission areas, should prioritize the adolescents and are qualified to A3 children with comorbidities, po may mga existing na mga sakit, and A1 children with health care frontliners. Ito po yung mga anak, kamag-anak po ng healthcare workers category. The Philippine Medical Association po since January 12, 2020 made a position paper on the nationwide vaccination program, and lahat po ng 118 composite societies, specialty societies po joined this undertaking. We conduct an information campaign po to increase the public awareness as to the need of the vaccination. We assist po, nakikita ninyo yung mga doktor ng Philippine Medical Association, siya po ang assist sa vaccination in complying the government's list of priorities. Sila rin po ang nag-monitor the effects and adverse reactions of the patients already vaccinated, and we report to the Department of Health whatever adverse reaction and other information gathered by individuals, physicians during and after the vaccination. And during the rollout of vaccines po sa children, at inaasahan po namin kami mga pediatricians ay lalong magtutulong-tulong para sa kapakanan ng ating mga kabataan. And last May 2021, the Philippine Medical Association launched the bakuna nagkaisa to encourage po our previous slides please, to encourage our physicians, doctors, nurses, medtechs, pharmacists to be part of the vaccination process po. Tinuturuan po natin kasi hindi po kakayanin lahat ng mga doktor ang pagpabakuna at pagbabantay sa ating mga health centers, sa ating vaccination sites. Next slide. Then, the Philippine Medical Association collaborated with the Vaccine Solidarity Movement last August 23, 2021. In our pledge, we will be in the forefront of the advocacy and aim at increasing the trust and confidence on vaccination. Kasi dapat nga po mga expert ang nandiyan at ito po ang pinaliliwanag natin sa media. We will speak and educate the individual families and communities about the value of vaccination. We proactive participate in undertaking aim at the improving vaccine trust, confidence, and coverage. Hindi lang po sa COVID-19 kasi po dumadami na as of now according to DOH po yung mga bakuna natin po sa ating mga centers ay bumababa po 60% na lang po from 100% noong time ni Dr. Flavier. And now 62% ang nagpapabakuna na lang po, 6 out of 10. At saka yan po ang nakaka-increase ng ating morbidity kasi yung mga dapat na preventable diseases po sa vaccine ay hindi po nabibigyan ng ating mamamayan. Kaya po we support the effort of this vaccine solidarity movement. Magkakaroon po kami ng pagtuturuan ng ating mga journalists kung ano po ang tungkol sa vaccine para hindi po mali ang binibigay nilang kaalaman sa ating mamamayan. At inaano po natin ang ating mga doktor, lahat po sana ay maniwala at magturo ng tama po sa vaccination. Pinaalala ko po, yung iba po namin doktor na namatay hindi nagpabakuna. Meron po tayong dalawa na doktor na hindi nagpabakuna, sila po ina-COVID ng grabe. Hanggang diyan na lang po. Maraming salamat po sa inyong lahat on behalf of the Philippine Medical Association.
Thank you so much, PMA President Dr. Benny Atienza. Very, very thankful po kami sa inyong binigay na take and the position statement also by the Philippine Medical Association. And now, for our final speaker who will also be our reactor, we wanted to get the perspective from a geographic location kung nasan po meron pong on-the-ground experience po talaga in terms of providing COVID-19 vaccines to children. So all the way, very, very late na po, no? Pero we are very thankful for her presence in today's webinar all the way from Delaware in the United States. Please welcome to the webinar Dr. Jennifer Liquido. Dr. Jeng.
Hello.
There we go.
Hi. Again, I'm reiterating, thank you very much for inviting me to provide perspective. Nakakatuwa. I'm learning a lot as well about what's happening in the Philippines. Kahit nagbabasa ako, iba pa rin yung napoprovide ng experts talaga with regards to what's happening in the Philippines. Now, I was invited to participate in this panel, and very thankful to provide our experience here in the US. So as they have said, we have been vaccinating children. Pfizer has been approved since May. And personally in the office, we have been vaccinating children 12 and up. Now, the one thing that we have to thank our presenters, Dr. Gonzales and Dr. Gonzales and Dr. Quiros for presenting a very good outline of what is happening, especially Dr. Gonzales with the vaccination. Kasi yun din na nangyayari dito. We are dealing with a lot of vaccine hesitancy. So maganda that we are getting science-based facts. Now, pareho din ang cases dito, pareho rin sa Pilipinas na indeed, for children, we are having a lower number of cases compared to adults and lower number of hospitalizations. Now, the state of Delaware is a small state, so we are the second smallest state. I'm just sharing on this slide yung positive cases per 10,000 population by age group. So you would see the 5 to 17 is this line with like sort of the periwinkle blue color. And nag-spike together with everybody around April to May, around here. And they have determined that like around June, the Delta variant is the predominant variant in the US. Now, even so, after this will be like around August and then September in here, this uptick in the line correlates with reopening of schools. So that's another experience that the Philippines doesn't have yet, that we have started here, is school reopening. So from late August to early September here in Delaware, the schools have reopened. And iba-iba yung dito kasi per district yung policies ng school. But generally, the Delaware has a mask mandate. So all kids and all staff are required to wear masks in schools. And then they have what they call a layered protection. So that means masking, physical distancing, which they reduced from 6 feet to 3 feet inside the classrooms. And then testing, routine testing. There are even some districts of school that they do weekly testing for kids who opt in for weekly testing. And then, of course, the other layer of protection is vaccination. And then I will tie that again later on with the effects. Next slide, please. So this is data from the CDC. So since the Delta variant, there has been 10% increase in hospitalization among ages 0 to 4. And then the hospitalization is 10% higher for kids who are unvaccinated. So we're saying, yeah, medyo mild nga ang cases for kids, pero meron pa ring risk. And then they have also noted that since the Delta variant as well, there has been an 8% increase in cases in kids. And they're saying this is because in the US, vaccinated na yung mga adults starting in December. So the greater increase in cases are more found in kids. And on the field, like in our office, we are seeing this a lot too. Na when the pandemic started, and of course everybody was cooped up in their homes, when there is a person who's infected in the household, siguro one person or two of them will get infected. Whereas ngayon with the Delta variant, when we see kids who are exposed sa household, siguro like 90% of the household will be infected within the next couple of weeks. So definitely there is increase in transmission and also increase in symptoms. When the pandemic first started, we will see kids who are testing positive and they have very mild symptoms. Konting-konti lang ang medyo severe symptoms. Now with the Delta variant, we are seeing that they come here with like high fevers. So dito, ano pa rin kami, hindi kami metric. So 103, 104 degrees, so which is equivalent to 39 degrees Celsius sa metric system. So more symptomatic. Now, the good thing though is, if we could have the next slide, please. So the good thing is we still have less of the side effects. So when we consider vaccination for children, like what Dr. Gonzales has presented, we consider what are the risks. So the bigger risk is the MISC, so the multi-inflammatory system in children. And this is ito yung data sa US, common for less than the median age was 9 years. And then of course may variety of race and ethnicity dito. So that's presented on that slide. And very rare pa rin naman, hindi pa rin maraming cases, but it is a risk, of course. And then we are talking about the myocarditis risk. And again, sinabi na rin earlier na yes, may myocarditis risk ng vaccines, pero mas mataas pa rin, almost 4% chance of getting myocarditis with the COVID infection. Next slide, please. And then this is the MISC cases and COVID-19 cases. This is being monitored by the CDC. This is, so we are seeing the broken line is the COVID-19 infection. The blue line is the MISC. So it correlates well with the COVID infection. However, itong gray areas on the end, akala natin mababa yung MISC. Actually hindi, because medyo delayed lang ang reporting, because usually MISC presents about 4 weeks after the infection. So may lag lang yung data. So again, there's still a risk, although lower. Now, one other thing, I think that's my last slide, but I just wanted to point out, no, meron pa palang, one more thing. So about the vaccination naman, again, we are lucky because we have started vaccinating. So wala pa obviously for less than 12, but for 12 to 17 year olds, we are at like about 54%. Target is of course like 75%. And then this brings about why we are not targeting it yet. And I think they've also have a report that less kids are getting vaccinated now rather compared to when it was first introduced or first approved. So this brings us to the topic of vaccine hesitancy. So sa Pilipinas mas mahirap pa because of the Demvaxia. Sa amin naman dito ay halos pareho din with what we saw on the video with the presentation. So ang mga reasons na binibigay sa akin ng mga pasyente, of course, is akala nila the vaccine was created very quickly na hindi hindi studied. In fact, yung monitoring ng adverse events is actually the COVID vaccines are the most monitored vaccines in all of history. Dr. Gonzales mentioned here yung VAERS, which is the Vaccine Adverse Event Reporting System, and then also yung VSafe. I enrolled in VSafe when I first got vaccinated, and even after 6-7 months, nakaka-receive pa rin ako ng text to check in if I've had symptoms or if I had a breakthrough infection. So maganda ang monitoring system, and hindi lang sa US, of course, with every other country, I think nag-i-implement ng monitoring system. So compared to other vaccines that were introduced, maganda yung monitoring system with COVID vaccines, and I think that's why marami ding reports of the adverse events. Now, other thing contributing to vaccine hesitancy are the side effects. They're fearful, especially right now with myocarditis, which is definitely an increased risk for the mRNA vaccines. I would be very happy to see like more data with the non-mRNA vaccines to see what will appear, and if there is really less possibility of myocarditis with those vaccines, then maybe they are more beneficial. But the thing right now is, do we wait? Do we wait for that data since the mRNA vaccines are now available? So that's a big question that we need to ask ourselves. And then another reasons I hear from parents and from teenagers is that, the vaccine may not be protective, that, there's a small risk that you can still get the COVID infection even if you're vaccinated. And on that note, I've actually had 3 teenagers who were vaccinated in June, finished their vaccination by July, who have had a breakthrough infection. So it is a possibility. Most of the, like 2 out of the 3 had just very mild infection, of course, just cold, coughing. Pero the last one that I saw had 102 fever. So 38 degree Celsius fever. But most of them are, the 2 of them who have recovered are doing quite well. And then last point with the vaccine hesitancy is, of course, that the myocarditis argument. Now, about the point naman against that is, aside from the clinical side effects of getting a COVID infection, the biggest impact in kids are the social impacts. So we have seen since the start of the pandemic that distance learning is not very good with most of the kids. And of course, na-exacerbate pa yung impact ng social gaps because of access to technology. So nakikita rin to dito kahit sa US kasi hindi din naman maganda ang internet and technology access of a lot of kids who are in lower socioeconomic status. So there are really learning gaps na nakita. Nakakatawa kasi when kids come in for their physical exams, I usually ask them, what grade are you in now? So, or anong grade ka na next year? And like 90% of them now, hindi na nila alam kung anong grade sila papasok nung summer. And nakalimutan na nila, parang nawala na yung 1 year of school. Hindi na nila alam kung nasan sila in terms of school. So that's one aspect. Another aspect that we're seeing a lot in here is na greater increase of reports of anxiety and depression in kids. So dito warranted kami to when we see kids for their physical exam, like the depression screening, and definitely nag-increase ang rate na napipick up na they're feeling sad most of times because they're not seeing their friends, nawala yung sports, nawala yung communicating physically with friends. And even in the age of social media, na parang before, the kids were just communicating through social media. Ngayon, parang nung nawala yung face-to-face interaction, they figure out that they miss it a lot. So, yun lang yung mga possible benefit ng vaccine na hindi clinical. And I just wanted to point that out. That's it for me. Thank you again for inviting me to this webinar.
Thank you so much, Dr. Jeng. Very important po para sa atin, no? Kasi especially as I'm trying to sift through all of the questions sa ating Q&A, there's one very, very important question that I will ask later on. But at this point po, may we call on all of our speakers for today. Dr. Chet, Dr. Conky, Dr. Benny, and Dr. Jeng to switch on their videos as we gather for our panel discussion. But before that, as we try to compose ourselves and prepare for the Q&A session, let's take a very, very quick break, maybe 30 seconds, for our special public service announcement for today.
Birthday, mahal!
Thank you, mahal.
Happy birthday,
Happy
Mommy!
birthday,
Hi,
Mommy.
Dad! Hi, Mom!
Happy
Thank you,
birthday!
mga anak. Thank you.
Love you, Mommy!
Miss na namin kayo!
I miss you, both of you. I miss you.
Miss ko na kayong lahat.
Mommy, sana magkakasama na tayo muli.
Miss na namin, Mommy. Happy birthday, Mommy.
Miss and love you, Mommy.
What did you wish for, Lola?
My wish, magpapabakuna na ako.
Ako din.
Dahil mahal ko kayo, magpapabakuna ako.
Thank you, TVUP. The COVID communication public service announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by our UP Vice President for Public Affairs, Dr. Neni Pernia, and funded by the DOST-PCHRD and the Department of Health as part of its AHEAD HSPR project. Dr. Susie?
Yeah, thank you very much, Raymond. And thank you very much to all our panelists. Jeng, it's probably 2 o'clock in the morning where you are. Is it? So thank you so much. You know, it's close to the top of the hour, Raymond, and we may not have a chance to have so many questions, but I just wanted to just start by asking for a little bit more information on this, because several of our speakers talked about if you have kids who are 12 and above who have an illness, pwede na silang pabakunahan. Kasi ang thinking natin, mas mahirap magka-COVID sila kesa magkaroon sila ng it's more difficult for them to get COVID. So maybe I'll ask Chet and Conky and Benny and Jeng to talk a little bit about that, because most people don't know that. They think all kids cannot be vaccinated yet. Mukhang pwede na, lalo na kung merong sakit. So Chet, please.
Well, right now, di ba 12 to 17 pa lang. So not all kids, no? So not those below 12. So for this particular age group, I think it was also recommended by many institutions and even DOH that the priority in fact will be kids who have underlying medical conditions, kasi sila yung at risk for severe COVID. So sila po dapat yung, for me, if ever there will be vaccine rollout for children and adolescents 12 years old and above, maybe we should start with those with comorbidities.
So Chet, ano yung mga comorbidity na yun?
Actually, yan pa ang pag-aaralan. Hindi ko alam, Doktora Conky yata ang kasama sa NITAG. Pero I would expect yung mga nakasulat dun sa slide ko na risk factor. So cardiac disorders or diseases, including congenital heart disease, chronic liver, lung disease, malignancy, hema-onco conditions, genetic or metabolic conditions, neurodevelopmental disabilities like cerebral palsy, Down syndrome. So these are just some of the risk factors that have to be taken into consideration para sila yung priority.
Yeah, Konki, what do you think?
Perfect, agree, and of course it's the pediatricians group of experts who will tell us ano yung particular comorbidities na to. However po, tabi-tabi, what I need to ask ang ating mga spesyalista, lalo na yung mga participants, is that it will be very, very tempting pag magro-roll out na for the comorbidities for us to certify na this or that child has a comorbidity kahit wala. Okay? So, tingnan lang po natin dito. Over to you, Susie.
Okay, so Benny, what are your thoughts on this?
Yes, since nagtatanong naman, and many parents kasi nagtatanong na sila kung available na yung COVID-19 vaccines natin, and I told them na dapat mabakunahan muna lahat ng mga nasa priority, susunod na yung mga bata, especially yung may mga sakit, and we do hope naman may mga pediatricians naman sila bawat mga may mga specialist tayo, will coordinate with the subspecialty society ng Philippine Pediatric Society.
Yeah, Jeng, what are you covering? What are you covering in the US in terms of comorbidities?
Well, in here we're lucky kasi we have abundance of vaccines actually. So hindi na factor ang comorbidity. So everybody's 12 and up can get their vaccines even from the pharmacies. So widely available, so hindi na factor in comorbidity. And then point out ko lang kasi kanina may nag-mention dun sa video na medyo yung bata on the heavy side, tapos natatakot sila sa side effect ng vaccine. Actually, yung obesity is more of a risk factor for severe outcome. So mas kailangan nga nila yung bakuna.
Okay, thanks a lot. Okay, Raymond, over to you. Maybe we have time for one question. Go ahead, Raymond.
Very, very quickly, 2 questions po, no? But this one, I will direct to Dr. Konki. And this is our most upvoted question. Why is the Philippine government recommending Moderna for the same age range when in other countries such as the United States, Moderna is not yet recommended? Why did the why did the FDA allow that for the Philippines?
I do not know the answer, no, but I can only say I'm not speaking for the government, but we know that it's Pfizer and Moderna that is available. Now, as I said kanina, maybe beyond that pay grade, maybe they're saying that because that is the most likely na bakuna na pwede nilang angkatin o pwedeng dumating at this point in time. But that is just my haka-haka. Over.
Thank you, Dr. Konki. And then the next one is mostly on the dosing po. A lot of, I think these are parents po kasi. Essentially, the question is, yung po bang dose na binibigay sa mga adults, yun din po ba ang matatanggap para sa mga bata? Paano daw po kung underweight yung adolescent? What are the safety precautions? That sort of thing. Maybe, let's direct it to Dr. Chet and then Dr. Jeng.
Okay, so yung sa studies, yung sa Moderna tsaka sa Pfizer, yung dose na ginamit nila is the same for adults. Pero yung mga later studies, like I think Pfizer and Moderna are conducting studies on 6 months old nga, di ba? Pataas. Sinovac, actually the phase 1 and 2 studies, they were actually studying yung bawasan. So half lang nung dose or decreasing the dose. And I think later on we might be seeing other vaccines that will come in with smaller doses kasi nga pinakita na in children the vaccine seems to be more immunogenic, so mas mataas pa yung antibody titers na nakukuha compared to the older age group, so it might be worth studying using lower doses. But sa ngayon yung Pfizer na darating at nire-recommend, pareho lang po yung dose as adults.
Thank you, Dr. Chet. How about in the United States, Dr. Jeng?
Yes, similar yung sinabi ni Dr. Gonzales. So, same dosing with Pfizer, and they have been studying lower doses for smaller kids. Pero 12 and up, same dose, same interval.
Okay, thank you very much. I think this could go on for a long time, but we can't. We're out of time, and we're going to give our speakers a minute to compose their last parang parting words, no? And then Raymond's going to share the results of the poll, and we're going to do an evaluation while you're thinking about your last few words to our audience. Our audience are mainly doctors, nurses, frontliners, midwives. We have people from the Department of Education, from our provincial health offices who are watching. So your parting words for them. And let me turn you over to Raymond for the results of the poll.
Thank you, Dr. Susie. For our poll, 1,003 respondents participated, at least in sa Zoom. Mas marami pa rin po ang madadagdag sa Mentimeter. The first question, kailangan na bang i-prioritize ang pediatric age group sa ngayon? So do we need to prioritize the pediatric age group as of now? 74% said yes. So it is more of an opinion po of our audience. And then second is on, can children age 12 to 17 with comorbidities such as cancer, diabetes, end-stage renal disease, and cardiac diseases be vaccinated now? 83% indicated yes, and that's something that based on the lecture we have learned also. We now, as our speakers are trying to come up with their parting words, maybe we can go on to our evaluation of the panel. TVUP. There we go. No. Okay. There we go. So for this panel, we are inviting our more than 1,500 attendees in the Zoom webinar to participate in our evaluation poll. Again, there is no separate na evaluation link that will be sent out. This is the one. So please, we hope that you'd be able to participate in this poll. First question, panelists demonstrated thorough knowledge of the topic. It's a Likert scale, so strongly agree, disagree, strongly disagree. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And number 5, contributed to new perspectives and knowledge on managing various key COVID-19 health issues. We will not be closing this evaluation poll as we move on to the parting words of our speakers in reverse chronological order. Thank you.
Okay, thank you very much, Raymond. And I'm going to ask Jeng first so that we can let her get some sleep. Jeng, what are your parting words for the audience?
Parting words lang, I want to say thank you to all the frontliners, especially sa Pilipinas. Mas matindi yung trabaho nyo dyan. So, mabuhay kayong lahat. And then for everybody else, the mere fact na nakikinig kayo dito sa webinar, that means you're seeking science-based information. So, continue doing so and continue, disseminating it to everybody to listen to or seek the correct information. Yun lang po. And stay safe.
Thank you very much, Jeng, and you can go to sleep now. Okay. So let's have Dr. Benny. Benny, go ahead. Our PMA president. Go ahead, Benny.
As of now, during this time of pandemic, the Philippine Medical Association is collaborating with the government and the LGU, and the doctors of the Philippine Medical Association should be proactive in participating and undertaking the improving the vaccine trust, confidence, and coverage. Sana po maabot po ulit natin na 100%, hindi lang po sa COVID, especially sa other vaccines po natin. Nandiyan lang po sila sa health centers at sa ating mga doktor. Yun po ang kailangan po natin. May COVID po o wala, magpabakuna po tayo. Matakot sa COVID, wag sa bakuna, wag maniwala sa fake news.
Thank you very much. It's Dr. Benny Atienza, President of the Philippine Medical Association. Okay, let's go to Conky, Quizon. Conky, go ahead.
Yeah, hi. So the operative word is priority. The reason why we are prioritizing is there isn't enough vaccines, okay? And the objective really of our vaccination is to prevent hospitalization and deaths. Kaya ganun ang order of priority natin. Sa madalit sabi, sana po nagkaintindihan tayo kung paano prioritization. Maraming salamat po.
Thank you very much. That's Dr. Conky Quizon. And let's go to Chet Gonzales. Chet, go ahead.
So before I give my parting words, thank you to my co-presenters and reactors. So parting words. So based on the available data, I think very strong ang evidence that the mRNA vaccines are actually immunogenic, they are effective, and they are relatively safe. And it's for children 12 years old and above, no? And it's good that we are also now having ongoing trials on the other vaccine platforms and other vaccines for children. I think that will be very valuable. Now, we saw that there were side effects, but overall, the benefits of vaccination are greater than the risks in those who are vaccinated and those who get COVID-19 disease. No, the risks are greater when you get the disease itself. But as Dr. Conky mentioned, there are still challenges. So specifically, availability, equity, logistics, programmatic concerns. And with your interview, medyo eye-opener yun sa akin, ha, na marami palang hindi pa tinatanggap ang vaccination for children. And I think we should really address that before we roll out the vaccines. Kung hindi, parang yan na nga, baka dengbak siya part 2 na naman. So we have to address really the vaccine acceptance or acceptability, and before we roll out the vaccination program in children and adolescents. Thank you.
Okay, thank you very much, Dr. Chet Gonzales. And thank you, Chet, for finding the time. Si Chet, narir na naman niya yung presentation niya, but you can see in the chat box, people love. I mean, for all of the presenters, you'll see how our audience appreciates all the hard work that you put into these short presentations, but really gives our frontliners a front row view of the information. Thank you so much. Okay, so to do our summary, no less than the Chancellor of UP Manila, who is also a pediatrician. So let's have Dr. Menchit Padilla. Menchit, go ahead.
So today's webinar was opened by Dr. Efrem Balanag, who said that it is time to focus on children, with more and more children being affected with COVID. There is an urgency for a policy on provision of vaccines to children, which must consider the issues of timing, supply, and the side effects. Now, allow me just to give the highlights of the presentations in the interest of time. Our first speaker is Dr. Chet Gonzales, and she said that in the Philippines, children comprise less than 10% of the diagnosed cases. But she continues to say that we do not know the real burden, probably because the symptoms are mild, leading to poor reporting, and probably poor testing. There was a big discussion on the major comorbidities, and that is going to play a major role in the policy decision on the priority listing. Now, the following are key considerations for introducing vaccine to children: epidemiology, safety, efficiency, effectiveness, mathematical modeling, programmatic implementations, and acceptance of vaccination in the ground, as shown by our dramatization today, that it is important that we address the concerns in the ground. But regardless of the reported risk for medical events, the benefits still outweigh the risk. And the benefits of the vaccination must always be emphasized. But let me just highlight the one that's going to affect the children and the adolescents. It is actually mitigating the psychosocial impact resulting from disruption of school, sports, other organized activities, and social events that are key to adolescent physical and mental health. Now, we heard various recommendations, and I just urge you to actively monitor. What we just have to know is that we've heard it from FDA that vaccines are safe for children and adolescents, but we must have to now address the challenges, which is primarily supply and coming up with the policy in terms of the priority. There's a long list of challenges, and I just urge you to continue watching this webinar to find out whether we have actually achieved in solving them. The second speaker is Dr. Conky Quizon, who presented the epidemiologic picture in the Philippines and presenting the local data and focusing on the 10 to 19 and below 10 years old, She also showed us that it is still less than 10%. But the deaths are actually higher in the older age group with a case fatality rate of 1.5%. It's still the same. The top three are still the NCR, the Calabar Zone, and Central Luzon. And Dr. Quizon concludes her lecture by saying that policy must be influenced by science. The first reactor is Dr. Benny Atienza of PMA. He takes pride in being fully vaccinated. Dr. Atienza starts his talk by reminding all of us that we must have access to reliable information. Listen to science. Watch this webinar. A practicing pediatrician himself, Dr. Atienza shares his experience on the ground. Children definitely actually present with milder cases. Second, because of the climate now, there are other respiratory conditions that are confusing the picture of our cases. The next issue is vaccine hesitancy on the ground, and probably is affected by the Denfaction case. At the end, Dr. Atienza just reiterated their commitment at PMA that it will play a major role in the advocacy of increasing trust and confidence on the vaccination. Our second reactor is a pediatrician from the US, Dr. Liquido, who shared her experience in the US. And there are shared observations. There are lower cases, there's lower hospitalization. Now with school reopening that happened much earlier in the US, they came out with layered protection, mask policy, distancing, routine testing, and vaccination. But definitely, there is a 10% increase in hospitalization for the unvaccinated patients. With the Delta variant, they have observed increased transmission and increase in symptoms among the cases. Now, vaccine hesitancy has been affected by also the side effects that has been reported to us by the mRNA vaccines. But regardless of the risk, regardless of the problems, there is still a big weight to the benefits. And just like in the Philippines, I would say that also in the US, there is an increased risk in depression among this age group. Now, we hope that this webinar has allayed your fears about vaccines for children. And I just want you to trust that the researchers and the doctors are reviewing the data to provide good evidence to our policymakers. Science will be the one who will give us the right answer. Maraming salamat po sa inyo, and back to you, Dr. Susie.
Thank you very much, Dr. Menchit Padilla, the Chancellor of UP Manila. I don't know how she does that. How she's able to summarize everything for us. When people are talking, I get lost in it. Well, we're really coming to a close, and I just like to say thank you to all our excellent speakers. You can see in the chat box, our audience really appreciates all the work that you've put into this webinar, and I'm getting text messages that this has been a very good webinar. So thank you to everyone, and thank you to our audience. But next Friday, you have to come back and be with us, because I'm very excited also about this topic. So Jeng and Menchit talked about this, okay? They were saying that the psychosocial or mental health problems of kids, particularly adolescents, is a reason for concern for all of us. And our friends in psychiatry are reporting more cases of attempted suicide, depression, anxiety, and all kinds of problems among our teenagers. We have increasing reports of domestic violence kasi nakulong sa bahay. Minsan, sinasaktan ng mga bata. A lot of trauma going on there. And so next week, we are going to have, in my view, the best child psychiatrist of the country today, Dr. Cornelio Banaag Jr., who is Dr. Cornelio Banaag, who is a revered mentor, professor, and he is considered the father of child psychology in our country. So he's going to talk to us about COVID-19 and mental health of youth. We're also going to have a trauma therapist who will join us. I've known her for many years, who has been working directly with children who are highly traumatized. What do we do? So I think this is something every frontliner needs to know. What do we do when we find kids who are suicidal, depressed, unable to do anything because of anxiety, or traumatized individuals. What do we do about that? We have to be able to know how we are going to respond, because this pandemic has created a lot of mental health issues. So join us next week. Huwag po kayong mawawala. Maganda po talaga magaling po na naman talaga ang mga magsasalita next Friday. Over to you, Raymond.
Thank you, Dr. Susie. So for today's webinar, this is arguably the most comprehensive content on COVID-19 vaccines for children that you would find anywhere out there, and we were able to really get it from credible sources. We have been fortunate enough that they have been available at least for this webinar to be able to impart their knowledge and their experiences around this, and we are really thankful to each and every one of our speakers, from our opening remarks speaker, Dr. Balanag, and then Dr. Gonzales, Dr. Quizon, Dr. Atienza, Dr. Liquido, and our Chancellor, all pediatricians par excellence, and very, very thankful for their presence in today's webinar. What you are seeing right now on your screens are the results of our evaluation poll. Very important to note, it's very consistent, above 90% strongly agree. We have 1,090 of respondents out of the nearly 1,600 in the Zoom who were able to participate in our evaluation poll. So maraming salamat po sa inyong lahat. We hope to be able to see you again next week. But before we end, we would like to thank the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, our webinar will not be possible. We are 72 episodes now, going strong. We hope to be able to deliver another 72 episodes for all of you out there. And then finally, all of our webinars are archived in the YouTube channel of TVUP. You'd be able to see from the very, very first webinar na medyo nangangapa pa kami on the way to our 72nd webinar for this one. Very, very important to note that we aim to deliver quality content each and every time that we go on the air. So this formally closes our webinar for this week. We look forward to your company next week again. Same time, same channel. Friday from 12 noon to 2 p.m. It's a date.
Together we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laugh before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The The others faint before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, I will hold the line. I will hold